On today's episode of our lactation education series, we'll be discussing how you can understand if your baby is getting enough while nursing. Let's begin by discussing some of the benefits of breastfeeding and chest feeding. Some of the benefits include a reduction in infant mortality and morbidity, and it's well documented within our healthcare system. Infants who receive breast milk during their first year of life have decreased risks in infection, as well as diarrhea and respiratory, ear, and urinary tract infections. This has been recorded by the American Academy of Pediatrics as of 2005. The long-term benefits of breastfeeding include decreased incidence of obesity and chronic illnesses such as diabetes, allergies, and asthma. The American Academy of Pediatrics and the World Health Organization now recommend exclusively breastfeeding for the first 6 months of life, with continued breastfeeding until at least 1 year to obtain these types of benefits. Less than 15% of infants in the United States have received this recommended course of human milk by the age of 6 months. Across literature, we have found that approximately 35% of childbearing individuals reported that they suspected that they were not producing enough milk, and that was their primary reason for weaning early. Perceived milk production can vary greatly from the actual amount that a person is producing while lactating. So it's important that people that are nursing understand ways to assess their newborn for satiation levels. Infant behaviors can be hard to understand because they use cues repetitively for a variety of different things. And so this is going to be specific to your baby. Infant behaviors can be challenging to assess because they're going to be different from baby to baby, and infant behaviors can be replicated from one scenario to the next. They don't have words like we do, so they have to use a very simple set of cues to let parents know a variety of different needs that they have. So, take this with a grain of salt because your baby is going to have their own way of being able to tell you what they need. But these are some general patterns that you might see amongst infants when they're trying to get their point across. Infants that have been routinely getting enough in quantity as far as food goes will be calm at the breast. When you hold your infant up to your breast to latch, they should not be lunging at the breast. They should be calmly opening their mouth, preparing to latch. But if you find that your newborn is fussy at the breast and is agitated per se, this might be a sign that they are frustrated with nursing, that they might not be getting enough milk when they're at the breast. Another way that you can look out for infant satiation is that they only cry when they are in need of something, and when that need is satisfied, that they are then soothed. So this is very independent per baby, but babies, as I said earlier, cry on an as-needed basis. So when their needs are being met, they should at that point be satiated. If your baby is constantly crying in between nursing sessions, or if your baby is even crying during a nursing session, this might be a sign that they are agitated with what is happening and that they are not receiving enough of their need, which in this situation would be nutrition. Rigid body posture, or on the opposite side of the spectrum, limp body posture from your baby can be a sign that they are not receiving enough nutrients while at the breast. Babies that are able to fall asleep and stay asleep with ease are typically babies that are being fed enough in quantity. When your baby is fussy and is unable to sleep for long periods of time, this could be an indication that they are not being fed enough while they are nursing. The last cue that I recommend to look out for would be what your baby is doing with their hands. Are their hands relaxed? And are their fingers unclenched? This is probably a good sign that their needs are met. If your baby is holding their hands very tightly fisted together in little balls, this might be a sign that they are frustrated with something, potentially that they are still hungry. One of the best ways to assess if your newborn is receiving enough milk is to understand their weight gain and to know if they're gaining enough per their age. From birth to 4 weeks old, you should be expecting your baby to gain roughly 0.8 ounces a day, which comes out to being 5.6 ounces a week. Those first 4 weeks are a very good indicator on what your milk supply is doing. Your milk should on average come in around day 5 or 6, depending on how many babies you've had. If you've had multiple babies, your milk might come in even sooner. So once your milk is in, at that point, you should be expecting that your baby should be gaining roughly that many ounces per week. And in a month, that comes out to being 24 ounces, which is roughly 1.5 pounds. Weight can vary greatly from one newborn to the next. There's a lot of factors that can take into play here. Maternal nutrition can be involved, and the caloric index of the milk. This also can be, weight gain can be contributed from genetics. So just because a baby might not be gaining the amount listed on this chart per week does not mean that the issue lies within the quantity of milk that they are consuming. This might be normal for them, this growth pattern, or there might be something else going on that is not related to physical quantity of milk. Weight gain in particular is something that can be very easily managed with your infant's care team, so keep in touch with your infant's main provider as far as weight gain goes, and make sure that your baby does not at any point fall off the weight curve. Diaper output has been shown to be not the most reliable in understanding your baby's nutritional intake, but it can be paired well with some of the other tactics that we talked about a little bit earlier to have a better understanding overall of what's happening internally for your baby after receiving milk. Stool color can be important. By around 6 to 7 days post-birth, your baby should be giving you yellow stools that might potentially be seedy in texture. This happens once colostrum has then been consumed and your milk at this point is come in. If your milk has not come in around day 6 or 7, talk with your care team and discuss possible options for supplementation if necessary, but otherwise expect that around day 6 or 7 that this should be happening for you, and your baby's stools should change accordingly. As far as output goes, on this time where the milk is then coming in, you can expect that your baby is going to be ramping up in how many times they are going to be pooping throughout the day. By day 6 or 7, or by the time that your milk comes in, your baby should be pooping no less than 3 times per day. If at any point your baby is pooping less than 3 times per day, keep in touch with your care team. This can be normal to have fluctuations in poop depending on growth in particular, but if your baby is not growing and they are having less than 3 poops per day, this can be a good sign that you might want to look farther into how much your milk supply has and how much your baby is actually receiving per feed. Here are the resources I used to make this video, and I appreciate you watching.